They'll probably be here. Okay, I'm going to go ahead. There's Representative Vaughn right now, so very good. I'm going to go ahead and get the meeting started. We've got a lot to do today. Conferees, welcome. Members, staff, conferees, welcome. Conferees, we're going to keep this to a tight 3 minutes. We have, I can't even count that high. So, okay, thank you, Francis. 24. So we have a lot of people to get through, and in fairness to everybody, we would limit your time to 3 minutes. Okay, very good. First up, and she is going to be so generous and give the rest of you her time. So, Representative Amy Campbell with the Mental Health Coalition.
Thank you, Mr. Chairman. Amy Campbell, Kansas Mental Health Coalition. My testimony looks like this. So on the first page, what you will see is a list of all of the governor's recommendations for enhancements for behavioral health services that our coalition is fully in support of. In addition, we add at the end of there to note the increase in funding for the Certified Community Behavioral Health Centers program that you all approved last year that's in caseloads, which is, of course, as you know, extremely important. This is very exciting to us because what you're seeing is a multi-pronged approach of expanding the availability of inpatient psychiatric beds, finally opening up and operating your crisis intervention centers, and even including funding to help with the long delays for competency and restoration treatment that have been plaguing our system for a long time. You've probably heard about that from your sheriffs, and if you haven't already, I know you will. There is an accompanying bill for that that's in House Judiciary right now, House Bill 2697. There is $1.5 million for suicide prevention. Obviously, we are very in support of that. And I would like to point you to the supplemental funding and additional dollars for the building fund and for the additional regional inpatient capacity beds that are also in the governor's budget. Her budget covers a multitude of issues that have been longstanding in the mental health system, and I know the legislature has been pushing for these solutions for a long time. Quickly, please note our ongoing crisis for workforce. You've heard it from all kinds of healthcare. Mental health is no exception. Additionally, you've got the legislation for the 988 National Suicide Hotline Designation Act that was passed by Congress in 2020. They did not give the states any money to implement that. It goes live in July of 2022, whether you do anything or not. So we are asking that you support the legislation that has some sustainable funding in there with a small fee on phone services, in addition to the state general fund dollars that have flowed through the administration. Thank you, Mr. Chairman.
Committee questions? Representative Vaughn.
Thank you, Mr. Chair. Just to follow up on the very last point you made, what was the outcome with the 588 number in terms of how they plan to fund it? Was that you said something about
988 in lieu of the 911. The feds told the states you should put this as a fee on phone services. A compromise piece of legislation came out of the House Health Committee yesterday. The bill as it was introduced last year had a 50-cent per line fee on it that was reduced to 20 cents per line. And then additional, I think they're anticipating about $3 million coming from state general funds. I expect that will change multiple times throughout the rest of the session. The advantage of having your phone fee is that that's sustainable instead of relying on one-time large ending balances that we may not experience in the future.
Thank you. Thank you, Mr. Chair.
Any further questions? Very good, Amy. Thank you for being here. Okay, next I have Matt Johnson. Matt, are you WebEx? Okay. Is Matt there?
How you doing, Mr. Chairman?
Good. Very good. Welcome to committee.
Thank you very much. Thank you, Mr. Chairman, and committee members for giving me the opportunity to speak today. My name is Matt Johnson. I'm the Director of Business Operations for Maxim Healthcare. We provide registered nurses and licensed practical nurses to patients authorized for specialized medical care. These are severely injured pediatric and adult patients with many medical complexities, that require significant amounts of continuous medical interventions. To start off, I would like to thank the committee for supporting the partial rate increase last year for specialized medical care. This was a great step in stabilizing the program and creating an efficient and effective program. Thank you so much. I do want to bring up that the current nursing landscape has gotten exponentially worse, and that's what I wanted to talk about today. I wanted to give a couple examples of what we're seeing in the field right now. We have families throughout all of Kansas that are looking for us to help fill their open needs, the shifts that they're not able to get covered that are authorized by the state. But we as an agency are doing everything we can to fill these needs, to the point that we are at points basically offering the reimbursement rate. And in many situations, even when we're offering at that amount, we're being turned down. This constant negotiation and pay increase requests have slowed our scheduling and recruitment operations to the point that it's going to have long-term impacts of our ability to bring on new patients. As a second example, in 2021, Maxim had a net loss of employees working in the field for the first time in my 15-year career. Nurses working in home care work in home care for a myriad of different reasons, but pay is usually not the primary driver. These are some of the most caring and compassionate nurses in the industry, but this healthcare setting, home healthcare, has always been looked at as different than their facility equivalents. The pay gap between home healthcare and other healthcare settings has simply become too great. And the other factors that drove nurses to the Hcbs settings can no longer supersede the pay that they can receive in other areas. This is causing a mass exodus of nurses from the home care field. And the home care field is the most desired setting for patients to receive care and the most cost-effective setting. There are continuing to be nurses just no longer impacting the Hcbs community. And we are just hitting the tip of the iceberg right now. Many nurses are staying with their patients because they've built a genuine connection with them. It is when the patient no longer is needing services that we are seeing these nurses declining to go into other homes and meet other patients, declining to meet other patients, and they simply leave home care for another setting. These are the most vulnerable patients in the entire state. I've provided testimony in the past showing that investing in this program has a great ability to create cost savings throughout the entire Kansas health ecosystem by reducing unnecessary hospitalizations, delayed discharges from the hospital. I can provide this info for any members that might want to see it. I do want to bring the committee's attention to some of the stimulus money and some of the packages KDADS is currently working on for recruitment and retention bonuses. For the workforce. I do want to make sure that everyone understands that that does not impact skilled licensed providers, so nurses, therapists, and etc. That is only for unlicensed non-medical personal care attendants. So I believe that a market-based rate increase will help us deal with the nurse pay rate challenges we see, and my request is that specialized medical care is increased to a minimum of $47 per hour. Thank you very much for the time, and I will be available for any questions.
Any questions? Seeing none. Thank you, Matt. Thank you for being here.
Thank you, Chairman.
Next, Sean Balke.
Yes, Representative.
John, if you could keep your comments to 3 minutes, as you may not have heard. Thank you.
Absolutely. Chairman Carpenter, members of the committee, thank you so much. My name is Sean Balke. I'm President and CEO for Craig Home Care. We are obviously one of the largest, I think you know me, we've spoken before many times, one of the largest providers for specialized medical care across the state of Kansas, one of the only ones serving rural Kansas. Matt was very eloquent in his comments. I'm not going to try to regurgitate that to you. We've spoken about this before. You understand the population. You understand what we're trying to accomplish. My testimony today is to, again, reinforce that we thank you for the support in getting to the rate that you brought it to last year. That simply didn't get to what we wanted, but it gave us a little progress. Unfortunately, it did not provide that same increase to the IDD waiver, which that same SMC services provided on that. That is in the governor's budget. We certainly urge you to support that. And like Matt indicated, our ask is to continue to pursue the rate for specialized medical care of at least $47 an hour. In addition to that, consider, we are making some proposal submissions to the SPARK committee And any support there would be greatly appreciated. We have not been able to benefit from the other allocation of funds, nor the previous allocation to hospital systems that went out before the Spark submission process happened. That's already happened, so that's already helped our competition, has not helped us. This next round with the KDADs piece of it is not going to help our nurses either. So request any support that can be provided there. Last piece is, that Matt indicated all the issues about, lower nursing staffing counts. That's all true. Rural Kansas is suffering, I'd say disproportionately. Now we're down roughly 20% of services this year over even last year, the same time period for rural Kansas. So wanted to make you aware I do have a map there that indicates the areas that I provide services, my agency provides services. Those aren't individual patients, those are regions and areas where there's service provided, so you understand the areas of impact. With that, I want to thank you again, reinforce the request, and stand for any questions.
Committee questions? Very good. Seeing none,
Right.
Thank you, Sean. Thank you for being here.
Thank you.
Next, I have Lynn Dalrymple.
Yes, thank you, Chairman Carpenter and members of the committee for having me today. My name is Lynn Dalrymple. I'm a lifelong Kansas resident and registered nurse. I'm the area director for Thrive Skilled Pediatric Care. We are a licensed and accredited home health agency that provides private duty nursing to more than 100 of the Kansas families on the TA and the IDD waivers. We are serving the most medically complex children in the community, doing all that we can to keep them safe, healthy, and supported. Once again, we're really thankful for the rate increase that we had in July of 2021. We did do some great things with it. We were able to do a new hire bonus. We were able to have a new paid time benefit that our nurses have never had before. We started a retention bonus and a sign-on bonus for new hires, and also an employee referral bonus. So we did make great use of that, as well as giving a wage increase, but it wasn't quite what we needed. So we would like to ask for the implementation of the rate increase to at least $47 an hour for the skilled nursing. That would provide additional and welcome relief and an incentive, as we're a home and community-based service and we compete with the hospitals and the other facilities. Just like Matt and Sean said, we didn't get any of the emergency money or FMAP money that a lot of the other nurses got for hazard pay. So that our ask would be, again, to go up to that 47, and also to ask for Spark funds that we would use to provide retention bonuses for our nurses. They do need and deserve the same support as the hospital and the long-term care nurses. We were able to put on the second page of the flyer that I've got to you. I won't bore you with that. I know that you can read through that. But also do want to add that it's really important that our IDD members get the same wage increase as the TA waiver members. It's a huge impact with our nurses, as they all talk to each other and they can see what each other makes. And that just needs to come and be equalized across the board. Does anybody have any questions for me?
Questions, committee? No, we don't. Thank you. Thank you, Lynn, for being here. Okay, very good. Next, we have Laurel with Senior Services of Wichita.
Good afternoon. Wow. Can you hear that? Okay, is that better? Can you hear me?
You may have something on near you. We can't hear you now. Try your volume. Yes.
Excuse me, Laurel, are you able to hear me? If you can nod, I can see you. Okay. All right, so down by where it says mute or unmute, there should be a little arrow. If you click on that, it will open up your audio menu. You can try going down that and making sure that you're on the system. We cannot hear you. It also says that you've joined from 2 devices. Oh, we actually heard you right there. How about now?
Let me try it now. Let me turn the volume down. Is that better?
A little bit.
Can you hear me?
Yes. Yes, we can hear you.
Okay. I will try to make this quick. I'm so sorry for that.
Oh, no worries.
We're having
Just,
some
you're
we're
fine.
having some computer problems. I'm Laurel Alkire with Meals on Wheels here in Wichita. We are the home delivered meal provider. And I'm speaking today on behalf of all nutrition providers across the state who provide meals to both homebound and active and congregate sites. As we all know, inflation has skyrocketed. Food is up 7%. Energy is up 72%. Gasoline is up 39%. Electricity 10%. That alone affects the cost of doing business. And for nonprofits, that's not sustainable. When COVID hit in March of 2020, Meals on Wheels was identified as an essential service. And I'm proud to report that homebound seniors across the state never missed a meal. Most days they were delivered by volunteers, but when volunteers were scarce, staff made sure they had a shelf-stable meal at home to eat. My staff here in Wichita assembled 20,000 shelf stables in April and May of 2020, and I know other programs did the same. Our mission statewide has always been to keep seniors healthy and at home where we all want to be. Senior nutrition providers work hard to keep our clients at home, and we do so in the most efficient manner. The state can rest assured that senior nutrition programs are good stewards of your money. In 2022, my agency can feed a senior for a year for $2,100. If they were unable to stay in their home, many would end up in state-funded nursing homes at a cost of $30,000, $40,000 plus. So you will get no better bang for your buck than you will with us. However, since COVID, there are many barriers that are preventing us from reaching everyone we'd like to. Supply issues continue to make it difficult to obtain the products we need to adhere to our menus. Deliveries come later and later. Staff have to stay late or come in on weekends in order to receive and put away the product. Salaries remain stagnant, and our programs cannot compete with other food industries that offer 15 plus per hour. I have kitchen staff that have been here for years that are just now making $10.50 an hour. And I have social workers that have also been here forever who are only making $15 an hour. It certainly isn't the pay that keeps them here, but the love of the clientele that who depend on us each day. However, replacing people as we retire is going to be difficult. I want to say I also understand there is some talk of raising the minimum wage over 4 years. While I think it's a noble idea, nonprofits would be unable to offer such a wage, and we wouldn't be able to compete with businesses who could. My food budget here in Wichita went up 21% over last year. We spent $100,000 more than budgeted last year on food, and we are looking at another $100,000 this year. And same goes for nutrition providers across the state. This is not sustainable with current state funding, which hasn't increased for senior nutrition since 2009. Additional and ongoing funding would allow us to raise the pay for our longtime staff. It would allow us to more fully afford the food and supplies we need to continue to feed our seniors. It would mean we could continue and avoid service cuts and long waiting lists. Providers throughout the state are asking for an additional $3.5 million in continued funding for us to catch up, to continue much needed services, and to survive. Thank you for this opportunity.
Any questions? Very good. Seeing no questions, thank you, Laurel. Next, I have Kyle Kessler. I don't see Kyle around. Okay, next we have Tim DeWeese, Johnson County Mental Health Center, WebEx. Tim, are you there?
Yes, I am.
Okay, very good.
So thank you, first of all, for the opportunity to be able to provide testimony to you all. You have my written comments, so I'll keep this really brief. Last year's CCBHC legislation, in my opinion, was the most significant piece of mental health legislation in Kansas since the Mental Health Reform Act of 1990. So thank you very much. In an effort to assist community mental health centers in transitioning to the CCBHC model, the possibility for centers to receive CCBHC implementation mini grants via KDADS would be central in making this transition a success. Second, most Medicaid behavioral health rates have not been reassessed or adjusted in well over a decade, so a modest 4% increase would be a huge move in the right direction to ensure mental health professionals are adequately reimbursed. Third, this July, in July of this year, 988 will become the national 3-digit dialing code for the National Suicide Prevention Lifeline. Funding the Kansas 988 Suicide Prevention Lifeline via cell phone fee will ensure that all Kansas are connected to in-state crisis services and stabilization resources. And finally, any additional allocation that can be made for the expansion of mobile crisis response, mental health clinician co-responders with law enforcement, or regional crisis stabilizations will ensure that cost containment across many systems by decreasing unnecessary admissions to jails, emergency rooms, and inpatient psychiatric units. Thank you again for allowing me to speak with you all today, and I'll answer any questions.
Thank you, Tim. Questions, committee? Seeing none, thank you for being here.
Thank you.
Next up, Mike Burgess. Mike, thank you for being here.
Thank you, Mr. Chairman. And as the chair said, I'm Mike Burgess, and I'm the Director of Policy and Outreach at the Disability Rights Center of Kansas. And my testimony should look like this for you. And first off, I want to say thank you. I really appreciate, Mr. Chair, you and the committee's work raising the protected income level to 300% of SSI. That has been a game changer, and I'm so happy with the way that worked out. Kansans with disabilities, I mean, I still hear about that in various places and how much of a difference that makes. And so I would be remiss if I didn't come here and thank you personally for your support and effort to help make that happen. Huge. But anyways, there's a lot of great things in this budget. So I'm just going to try to highlight two. And I know there's a lot of other conferees that are talking about other things. And I'll say I agree with a lot of what a lot of those folks are saying too. One is the increase in the lifetime limit for assistive services. So you'd think of home modifications or vehicle modifications. That change, it's a measured but meaningful improvement. We would love to see that cap raised even more, but this point will definitely make a difference, and do want to share our support for that. The other one is the standardization and slight increase in the Hcbs personal care rates. And that's across several different waivers that happened, and they were at slightly different rates. It also includes a modest 2% increase. And so that is a good piece, but I want to encourage you, actually, if at all possible, that would be one place where you could do an enhancement. And there's some examples in my testimony that talk about kind of what this really means for individuals with disabilities who are in their homes. one individual, she had to go several weeks without a shower. So this is an individual that works. Unfortunately, she lost her worker, and she was able to, she got by in the community, but you can imagine the trauma and challenge that created, having to go to work every day knowing that you hadn't showered for more than a week or 2 weeks or 3 weeks. That's one example. There are other examples, being able to transfer from your wheelchair to be able to go to the toilet. Individuals with quadriplegia need their feeding tube cleared if they have a feeding tube. So there's a number of situations where, these are very, very important work that these individuals are doing, and they're not paid very well, frankly. I think in other testimony, you can see where it's typically $9 or $10 is often what they're paid. And the biggest fear is you look at the, there was testimony at the Bob Bethel where 2 individuals talked about this. For a lot of folks, their biggest fear is losing their worker. You can't say that enough, how much that impacts their ability. And for folks who don't have a worker, it's finding a worker. And that's, this is, definitely make a difference work for those individuals. And so with that, Mr. Chair, there's a link to a story. I encourage you to look at that too. There were 2 individuals that testified at the Bethel Committee, which I know several folks were in this room were at, but they shared their testimony as well. And I want to reiterate, they say it, that they're the ones directly impacted, and they say it well, the impact to them. With that, Mr. Chair, I'd be happy to stand for questions.
Very good. Thank you. Committee questions? Seeing none, you're off the hook.
Thank you very much.
Thank you, Mike. Next, we have Matt Fletcher with Interhab. Matt, welcome to committee.
Thank you. Thank you, Mr. Chair, and thank you, members. There we go. I am Matt Fletcher. I'm the Executive Director of Interhab, and I appreciate the opportunity to appear before this committee this afternoon to discuss the concerns of the members of our association. To put it short, the Kansas network that serves persons with intellectual and developmental disabilities is in danger. It's in danger due to a combination of chronic underfunding over the last 2 decades, coupled with the critical workforce shortage that is occurring across our state and will continue for the foreseeable future. I've included a chart in my testimony that shows the funding stream for IDD providers, which is the IDD reimbursement rate. That rate has been adjusted only sporadically over the last 20 plus years. And in that chart, you can see a comparison of those rate increases to just simple inflationary increases during that same period of time. You can see that the IDD system has lagged behind CPI, and we are about 30-some% behind where just simple inflationary increases have taken the price of doing business over that same period of time. What that means is that the IDD system's capacity to serve individuals already in the system is eroding at an alarming pace. We're not even talking at this point about how to bring individuals off of the waiting list, which now totals more than 4,600 children and adults. We're talking about whether or not this system will be able to maintain services for those roughly 9,000 individuals who are already in service. And what we're seeing across the state is very troubling. We're seeing residential settings closed or consolidated, meaning that individuals are moving into settings with larger numbers of individuals in that setting. We have had isolated instances where on an emergency basis, individuals had to be moved into the organization's facility for a short period of time because staffing just wasn't available to go out to the residential setting to provide supports. That's where we're at right now. And I can't tell you where we're going to be in 6 months, but frankly, I'm pretty scared of where we might be headed. I've heard from my peers in other states, and this is a similar phenomenon that other states are experiencing, where providers have had to shutter their doors, drop clients off at the emergency room because there was nowhere else to take them. We don't want to get to that point here in Kansas. That's not how we do things. We do things right here. And the right thing to do is to put funds into this system. I propose a significant influx of funds, $58 million SGF. We believe that would equate to about a 30% increase that would allow most, not all providers, but most providers in the system to be able to raise direct care wages to $15 an hour. And that's what we're competing against. We're competing against fast food restaurants that can pay $15 an hour for their workers. We can't do that. And if we don't help these providers be able to be competitive, we are going to be in a lot of trouble in terms of where Kansans with IDD are able to find services and supports. One final thing, and then I'll close. In addition to that funding request of $58 million SGF, the CDDO system, the gatekeeping system for the state of Kansas for the IDD services across the state, the administration rates for those gatekeepers have not been adjusted in over a decade. The leadership of KDADS, after going through contract negotiations with the CDDOs last year, put in a funding request for $2.5 million SGF for an increase, the first increase in administration rates in a long time. The administration chose not to include that in their budget. We would ask respectfully that you consider the inclusion of that $2.5 million SGF. And with that, I will stop and answer any questions at the appropriate time.
Very good. Committee questions. Representative Helmer.
I cannot find your written testimony.
I apologize.
It's in there, I know, but I just can't find it.
It's in the whole bunch.
But may I ask you, you're talking about the gatekeeper for these people. Who are the people, who are the employees that are, just name off the category of who we're talking about? Like what are their titles?
Sure. So in the first part of my testimony, I was referring to direct care workers who actually do the vital direct care work in the community. The common professional term for that is direct support professional, but you'll find at different organizations they may be called different things. But the essence of what they do, well, the gatekeeping entity is separate from that. That's a Community Developmental Disabilities Organization, or CDDO, as they're referred to. There are 27 of those CDDOs across the state of Kansas, and they perform the gatekeeping function for the system. They determine eligibility, they help families and individuals connect to service providers in their region, and they ensure network adequacy of services in their region by affiliating with qualified providers.
Thank you. And they haven't been, there hasn't been any wage hike for them for how long?
So that's an administration fee that the CDDOs receive from the state to perform this administrative function on behalf of the state, and that's in statute. And that administrative rate has not been adjusted, I believe, for over a decade.
That's what I was trying
Yeah.
to. Thank you very much.
Thank you.
Thank you, Mr. Chairman.
Committee, further questions? Representative Ballard and then Representative Ruiz.
Thank you, Mr. Chair. Your ask is kind of steep.
It is.
Wow. I agree that it's needed, that we have been real negligent in how we've been funding disabilities, mental health, and a whole number of things. But this would, if I'm reading it correctly, it would actually, according to what I see here, make it possible for you to offer like $15 per hour wage. Is that all included in that 58 million?
So 58 million SGF would net us an additional approximate 86 million of federal funds that's out there for the taking. If we invest the 58, we get another 86 that comes back to the state of Kansas for these services. And you have to remember, it would go into the IDD provider rate, which is the artery of funding for how these providers stay afloat, keep their doors open. They don't have private pay by and large. It's very, very rare to find private pay. They don't have alternative funding streams. This is it. And we know it's steep. And where we started last fall in thinking about this session was much different in what I asked for today. But it should be a signal to legislators that the situation is pretty precarious at this point, because as a system, we have never asked for more than we felt we needed to do the job.
The only thing I would say about that, though I said it was needed, is right now we're doing, with the money we have, it's almost like one-time money. Because we know it's more money than we expected to have at this time. It's one time. But even if we could give you 58 million, we have to be able to make sure that we can sustain it.
Yes.
And not, when it runs out, you're back to where you were before. Does that make sense?
Absolutely, it makes sense. And that's not an easy job for you all. That's why I never considered running for the legislature. It's a hard job.
You feel sorry for us.
Well, I do, but this has to be a priority of our government, and the people who are most vulnerable, who live among us, we have to make that a priority. And if the system is close to collapse, and it is in a very precarious position now. I don't know what we would look like next week or next year if we were waiting around to see what the financial picture looked like then. I think we've got to move, and we'll work with you together when next year comes.
Representative Ruiz.
Thank you, Mr. Chair. Yeah, that is a very steep ask. And I'm looking at the paragraph that says action is needed now, and I'm just trying to sift through it. How would the 58 million SGF garner 86 million?
Sure. So we're funded for Medicaid services through roughly a 60-40 match of federal and state funds. So we put money in, and the feds, bless their hearts, they send us even more money than we put in. So this is a good investment in that regard, that we would be able to leverage a great deal of federal dollars as an augmentation of the investment we make.
So you're saying that you need 86 million in order to be able to raise wages to $15 an hour for all the direct care workers?
What I'm asking for is an investment of 58 million SGF in state funds, and then we'll see what we can get from the feds to match that. We think it would bring down an additional 86 million of federal funds.
So, and I think I've shared this in this committee before. One of my frustrations is that, you know, we allocate funds for wages, but then we hear from the actual workers. I have constituents who are direct care workers with IDD population, but also with mental health and others. And they tell me they're not seeing the wage increase. And it's very frustrating to me, because I tell them we've given the money, but then they're not getting it. And I'm having a difficult time with, you know, how do we guarantee that that's what's going to happen? So if you're asking us for this to be a priority, then are the agencies, is that going to be their priority, that money goes there? But you're not going to need 86 million. So that, and I also thought that since this past summer, that the staff were already getting $15 an hour. Yeah. So they went from what to what?
So the average wage in the state of Kansas is a little below $11 an hour for our DSP wages. Starting. Yes, starting. Yeah. And I know there have been some questions about the previous rate increase that you all worked so hard to put in. And you're right to ask those questions because it was a large investment last session. We asked our members, how did you utilize the rate increase that was passed by the legislature last year that went into effect in July? Our members responded that they used 97+% for wages and benefits for direct care workers. They are hemorrhaging staff right now. And anything we can do to help them will go to direct care.
Representative Reeves, let me help you understand this, because I mean, I was very disappointed like you were. First of all, I didn't realize there was 20,000 workers out in the ID and DD system. So that was a very big shock to me at that point in time. Then I'm looking at the figures from last year. It was 13 million SGF, 34 million all funds. So we brought that down. So it's kind of like if it was 50 million, then it'd be 130 million, you know, type of deal. But what happens is you can't have wage compression. So, you know, you give the bottom layer $1 an hour. You can't, you know, the folks that have been there, you know, they got to make $1. So basically, probably everybody got, you know, that amount of money or $2, and you know what I mean. But boy, no doubt, I was so disappointed last year when that came back. I was like, huh? And so anyway, I do understand your frustration as far as this goes. But we will be taking a look at it. So anyway.
Our members would welcome that examination. They would love to explain how they use the funds to bolster their workforce, and they would happily open their books and show you that. Yeah.
We might need to do that.
That's understandable.
Thank you.
Okay, committee, further questions? All right, Matt, thank you very much for being here. Next, we have Vicki Kiefer, Sunflower Diversified Services. Vicki, are you there? Let's see if we can get her on right now. We'll fill in. I see Kyle Kessler finally got out of bed this morning, and and here he is. Yeah. Okay, very good, Kyle. Thank you for getting up for us and making it to a 3:30 committee.
Yeah, thank you, Mr. Chairman. And clearly, this is the very last committee. I wanted that to happen, and for just that reason. And again, I am Kyle Kessler, Executive Director at the Association of Community Mental Health Centers. Appreciate the opportunity to visit with you all very briefly and provide testimony on the KDAD's budget. And I will be brief with my comments. I know you've heard from Tim DeWeese already from Johnson County Mental Health, and have Lisa Southern from Compass Behavioral Health out in Western Kansas here in a few minutes. And but really, and several of you are on the Health and Human Services Committee and heard my comments earlier in the week on the 988 legislation, and it's become regular that we will talk with you all about our analysis of the state suicide statistics and where those have gone. And for the first time, I think last year, in at least half a dozen years, I was able to stand in front of you and talk about not an increase in the number of deaths by suicide, but a reduction. And for someone who's a Health and Human Services policy wonk like me, it's really hard not to look at all the work that each of you have done on this committee and collectively as a committee at the public policy and public finance enhancements that you've put into behavioral health, and not connect the improvements in behavioral health and the potential that you've saved lives by the investments that you've made in behavioral health. So first of all, thank you so much for that. I also know that even recently in the last month, the New York Times published a report that showed a poll of 80,000 school-aged youth, and they reported that 25% of the youth reported feeling depressed or feelings of depression, and about 20% reported feelings of anxiety. Now, my initial reaction to that was, that sounds really low to me, given where we are with the pandemic and issues with social media and those kinds of things. But in any other time in history, those numbers would have been very compelling to us to say that we need to invest more from a public policy and finance standpoint into behavioral health. So to that end, I'll make our asks very quickly. One being a 4% increase in Medicaid rates for behavioral health. That is something that the Mental Health Modernization and Reform Committee, which I also know several of you have served on, that they have recommended a 10 to 15% increase in Medicaid rates the last couple of years. And in fact, the Legislative Mental Health Task Force, the 2 years before that. So we've got 4 years of recommendations on Medicaid rates, and we would really like to see a 4% bump in that area. Then second, funding for 988. I know House Bill 2281 has been heard and referred from House Health and Human Services to Senate Utilities, and that has a funding mechanism in it. But if that does not pass, it may need some blended funding, either some help from you all or potentially to be completely funded from Social Service Budget Committee work or House appropriations. Then lastly, what I would mention is that we also included our Spark requests for stimulus money, just so you all would have an idea of what we were asking for in that. This is a bit of a confusing process for some of us who work around the budget process quite a bit, which is fine. We'll take advantage of any opportunity we can to promote the need for more mental health resources and behavioral health financing. So with that, Mr. Chairman, I would stand for questions at the appropriate time.
Committee questions? Seeing none, thank you.
Thank you, Mr. Chairman.
Kyle, you know I was just joking about that.
No, I'm going to perseverate about it for days, Mr. Chairman.
Okay. I just, in this day of politically correctness, I need to make sure that everybody knows that it was a joke.
I think you intimidated.
No, not at all. Okay, Vicki, are you there?
I am.
Very good. Welcome to committee.
Thank you so much. I am using my desk phone because I think the microphone is usually a little bit more clear. So thank you for the opportunity to visit today. I'm the Director of Human Resources for Sunflower Diversified Services in Great Bend. In Human Resources, we're looking for people to make a career of a DSP. Just this last week, I spoke to an applicant who was considering DSP as a career choice. When I spoke with her, she said, well, let me tell you a little bit about my home situation. She says, my rent is $400. My utilities run around $200 a month, and that kind of covered gas and electric and water and trash. And she went on to say that she needed health insurance for herself and her kids. She also has a car payment that was only $200. But she needed to have full coverage insurance as well. And by the time we crunched the numbers, it was obviously clear that she couldn't afford to be an employee of mine, because after she paid her monthly commitment, which she had no credit card debt, nothing like that, nothing out of the norm, she had $1,520 to spend on clothing, birthdays, holidays, family activities, savings, dental, vision for herself and her child in a year. There's no way that at $10 an hour, I could expect her to make that commitment to her family when her heart felt like it was something that she wanted to do, she was drawn to do. She had a friend, she had a neighbor that she had helped. It felt like a good career choice to her. But she was not able to financially make that change. And to think that we could raise her maybe 30%, raise her to a $15 wage, it certainly would have been something she was able to consider at that point in time. She's gone on to other opportunities. And sadly, she went to a fast food restaurant just down the street. She works at the drive-up window. I saw her a couple days later, and there she was. So I know that we raised the base pay last year, and it took my employees from $9 an hour to $10, but it did not do anything to our tenured employees. Our tenured employees that have dedicated 10, 15, 20, 25 years of service to the organization, they didn't get raises. It was just to adjust our base pay within our organization. I know Representative Ruiz had questions about that. And we were just raising our base pay to get the people in the door. It's very disheartening when we spend over $300 and 30 days worth of training to get someone in the door, and then they're offered $3 to $5 more an hour to work at a fast food restaurant down the street. We're expecting them to save people's lives. We're expecting them to be honest in providing the care and the comfort care and that private personal care that some of the people we support need. And we're not able to keep staff happy and engaged and dedicated to this career choice at $10 an hour. I'll stand for questions.
Committee questions? Seeing none, very good, Vicki. Thank you for being here.
Thank you so much. I appreciate the opportunity.
All right, next I have Penny Hcbs, Direct Support Professional, Cottonwood. WebEx, are you there?
I am here.
Very good.
Can you hear me?
Yes, thank you for coming to committee.
Thank you, Mr. Chairman and members of the committee. My name is Penny Hcbs. I'm an employment consultant and a direct support professional with Cottonwood, Inc. in Lawrence. I really thank you for giving me this opportunity to share with you my experience in those roles and express just how important it is for individuals providing those services be paid higher wages. My primary position at Cottonwood is as an employment consultant with our JobLink division. I help adults with disabilities get and keep jobs. Often those jobs I get for them pay more than I earn as their employment consultant and job coach. To answer your questions earlier, I did get a $1.50 increase last year thanks to the legislature's 7% funding increase, and sincerely thank you for that. But the reality is I and my coworkers still have to work overtime and second and third jobs in order to make ends meet. So I serve as fill-in staff in our residential homes. I do this because our organization is unable to fill those positions, but also because I need the overtime to pay my bills. I love working in the residences, but I also have a front row seat as to how a revolving door of staff affects our consumers who struggle to communicate needs, frustrations. And there's always somebody new coming into their homes, helping them bathe, touching their stuff, their belongings. The reality of being understaffed affects the care we're able to provide them. Staff work full-time jobs like me all during the day and then fill in at the houses at night. Other staff are working 16-hour shifts, multiple days in a row. We're tired. Many times there's only one staff person per house, so only basic needs are being met. We are often unable to provide any sort of enrichment, just even something as simple as taking a van ride. This leads to anxiety, frustration, often negative behaviors in the consumers. An example of that frustration, several weeks ago, I was working in a house that I frequently fill in, and a consumer there that I've grown very close to, she was really kind of lashing out. Prior to the pandemic, she lived in an apartment with no roommates, but she did have a staff assigned to her full time. Due to those staffing shortages, she was moved into one of our residential houses, a group home. Now, once again, due to staffing shortages, she and her roommates are moving to a new location. That night that I was helping her, I was trying to get her to come and eat her meal or her dinner that I'd cooked. She became very frustrated and she punched me. And this was so out of character for her. We have a really, really close relationship, a really good bond. I sat down with her about a week later and we talked about it. And she said she's just so frustrated about all the moves and she misses all of the staff that she's lost over the last year, people that have left their jobs. I just hope in some small way this illustrates the rippling effect that the funding has on the people that we serve, not just us, but the people that we're supposed to be serving. The staff that leave, and there is a lot of leaving. They always say they love the job. They love working with the consumers. They love what they're doing, but they're forced to seek higher wages elsewhere, usually with less responsibility. Okay. Bottom line, the well-being of the people we serve depends on regular routines and trusted caregivers so they can feel stable and secure. And we just can't provide that if we're unable to hire and retain staff with better wages.
Okay.
Well, thank you for the opportunity.
Thank you very much for your time, and thanks for coming to committee. Next, we have Abigail Searcy. Abigail, are you there? Can she hear us? Let's go down to Gail Ritchie real quick. Gail Richardson, parent, Lake Mary Center.
It was a wonder.
Who is it?
Nobody's here. Nobody, they all left.
Yeah.
I don't.
Ugh. Can you hear me now? Oh, no.
Yes, we can.
Oh, good.
And
all
you
right,
are,
well,
you're Abigail?
I'm Gail Richardson.
Okay.
Is that who you called on? Yeah,
fine.
anyway. Oh, thank you. Chairman Carpenter and members of the committee, thank you so much for allowing us to testify. And I would like to tell you, I am a parent and we are where the rubber hits the road here. And I think everyone who has spoken has spoken truly. And I just have a little bit different perspective. I would like to thank you very much for your support last year, increasing our rates for our providers, for people with developmental disabilities. We do appreciate this increase. However, as you've heard from other speakers, services for our kids have been significantly underfunded for some time. And when you don't give us the state increase, we don't get a federal increase. For the past 20 years, funding for Kansans with IDD has lagged inflation by 31%. And that forces some of our providers to eliminate services or go out of existence entirely. So if we are losing providers and those that are still in business are losing money on every new person they bring in, I don't want to speak about the wait list, but it is frustrating for those on the wait list because how do they have any hope of receiving services? We don't even have enough employees and providers to serve those we have now. And then of course came COVID with its shortage of workers across the economy. My son is served at Lake Mary, and presently the number of caregivers at Lake Mary is about half the number that we need to ensure our kids' health and safety. And since it is the state that sets reimbursement rates for our providers, we cannot hope to compete with the private sector for employees. We can pay maybe 2/3 of what a private employer can offer. So the IDD system in Kansas has been unstable for a while. And now I would say the system is crumbling. It's like that game Jenga. Can you see this? That's a game called Jenga, in which players take turns removing a piece from a wooden tower until finally a player removes a block that causes the entire structure to collapse. That's how we view the situation now. And I hope you don't think we're fear mongers. This is the truth. My husband and I have a son, Rusty, who is developmentally disabled. Rusty's 50 years old, and my husband and I are in our late 70s. And in case you were worried, committee, I did take a nap today. Like many families, we rely on Lake Mary to be there when we can no longer oversee his care. There are 5 people in Rusty's group home, all of which have very intensive needs: bathing, dressing, behavior management, meal preparation, paperwork, and medical interventions. One caregiver per shift is simply not enough to do this. And now our staff are asked to work double shifts to cover those who have left out of exhaustion or for better paying jobs. My son Rusty would love to be independent, to have a job, and to be able to take care of his needs. He was not dealt that hand. And so we look to our legislators to help support him. I hope you agree.
Gail, I have to get on with committee here. We've got another.
I get it, but may I just make one more comment?
Yes, wrap it up very quickly. Thank you.
Okay. There is a beautiful way to support us, and that is to use a small portion of our current state surplus to pay down some of the unfunded liabilities of CAPERS, and then use that money that we would save in interest payments and reallocate it to provide services for our folk. Seems like a good trade-off, interest expenses or services for our kids. Thank you for hearing me out.
Very good, Gail. Thank you very much for coming to committee. Were you able to get Abigail on there? Okay, that's fine. Okay. Next, I have Colin McKinney, Starkey Inc. Colin, are you there?
Good afternoon, Mr. Chairman, members of the committee.
Very good. Welcome to committee.
Thank you so much. And with all that we've heard, I've got to tell you that, you know, you submit your testimony and there's things that you want to nail, and then you hear other people talk about what's important, and that is what you want to tell the committee. But I think we all want to tell you and everybody here today, thank you for the support that you've shown. 3 years, the rate last year was to sit and listen to the conversation. I've been the CEO at Starkey for 10 years. It's been very rewarding work. We touch a lot of lives. We serve more than 400 individuals with intellectual and developmental disabilities every year. And there's no more rewarding work that I could think of unless you're talking about pay. You know, our employees who are still with us are working for reasons other than money. They're working because this is the work that makes their heart sing. How bad is it, you might ask? Right now, we have approximately 150 vacant direct support positions. So about 45% of all of our direct support positions are vacant right now. And that means that anybody else who can work a shift is doing that. They may be doing that day after day for weeks on end without any significant break. And that's going to affect the quality of services. As you've already heard, persons that we serve, you know, they don't like all the change and the irregularity. When I work a shift, they're saying, okay, who's coming in next? They don't know. And they deserve consistency. They deserve quality of care. We are making a big ask this year. But if we ask you for $10 million and it allows us to increase our wages by another 75 cents, then we have this conversation all over again if we are able to continue doing the work that we do. And that is truly in jeopardy, as Matt shared with you. We need to be able to increase wages substantially. And I greatly appreciate the questions of Representative Rees. You know, where did the money go? In our case, the money went to wages and more. We increased wages between $1 and $5 per hour. And then the piece that, you know, when you get feedback from an employee who says, I don't know where all the money went, we will pay about $2.5 million in overtime this year. We pay every employee who works a weekend shift an additional $2 an hour. All the one-time bonuses that we pay, you know, because we don't have ongoing dollars to pay them. And so if we were to add up what we received through the rate increase last year versus what we've paid out, you funded a portion of what we are funding. And I'll be honest, you know, some of what we have done this year is just hoping that some additional funding will come in and we can continue that. The last thing that I would want to tell you is I was fortunate enough to hear the comments from the two superintendents of our state hospitals for people with IDD. And all along I've been worried, okay, so if we could do $15 an hour, would it even make a difference when we have 150 positions that we need to fill? And I was so optimistic after hearing them. They received state money already. And they were able to increase their wages to $16.16 an hour as a starting wage. And they were gushing about how much success they'd had in filling their vacant positions. I don't expect to get to $16.16, but if the funding that we're looking for would allow us to get to $15 an hour, and I believe it would at our organization, I think it would have a similar difference. I think people who would otherwise go work at all those other job opportunities that are out there, they would continue to stick with us and do the work that they love. And continue to, you know, to change lives. Lots more I'd love to tell you, but I know we don't have time. Thank you again for the opportunity, and I'd be happy to answer any questions that you have.
Very good. Thank you, Colin. Committee questions? Seeing none, thank you. D, I'm not even going to, Sedgwick County Developmental Disability Organization. D, are you there?
Yes, I am. Good afternoon. Can you hear me?
Yes, thank you very much for coming to committee.
Good afternoon, Chairman Carpenter and members of the committee. I appreciate the opportunity to come to you via WebEx today. My name is Dee Niswonger, and I serve as the director for the Sedgwick County CDDO. We're one of 27 CDDOs across the state charged with the local stewardship of the IDD service system as articulated in the Developmental Disability Reform Act. At my CDDO, we have 2,600 eligible individuals and provide access to services through our network of 43 organizations. Of those eligible individuals, 958 are currently on the waiting list. The number of those waiting in our community has grown by 12% over the last 5 years. CDDOs are extremely concerned for the current DSP workforce crisis and the fragile state of our local systems of care. As reflected in my written testimony, CDDOs are mandated to assist in establishing new community service providers if all providers are at their maximum capacity, and we cannot require them to accept more persons than can be effectively served. Unfortunately, it's nearly impossible for those CDDOs to create new service capacity under the current conditions. CDDOs have a critical role in local system development and management, from addressing emergent situations with individuals in crisis who have very complex needs, to managing the COVID-19 pandemic response in our communities, to ensuring no service disruption occur for people who rely on them when we're notified of unexpected provider closures. CDDOs are spending more time in assessment, gatekeeping, complex case consultations, quality assurance oversight, network management, as well as capacity development. I've articulated cuts in my CDDO funding in my written testimony. The elimination of SGF in 2011 forced many CDDOs to move individuals whose services had been funded by those dollars to state aid funds. State aid funding provides communities discretion to fill service gaps identified, particularly for those without access to waiver funding. The change in 2015 to the match rate calculation and the 2016 state aid cuts further eliminated funding and eroded the ability of local communities to address unmet needs. We respectfully request that $2.5 million be added to the KDAD's budget for CDDO administration to address the cost of doing business in our current environment, and more importantly, to stabilize the system of local management and oversight that is required by state law. We're asking you for your help to ensure appropriation of funding to help those living with IDD to have the same opportunities to live, work, play, and pray in their community that you and I have. Thank you for your consideration, and I'm available to answer questions.
Very good. Committee questions. Thank you very much for being here, Dee. Next, I have Ron Fugit, parent via WebEx. Ron, are you there?
Yes, I am.
Very good. Welcome to committee.
Here I am, right where you left me.
Thank you, Chairman Carpenter and the committee for having me today. I appreciate it. I'm Ron Fugate, and I'm a parent of a 47-year-old son who has IDD. Now, he receives residential and employment supports at Lake Mary Center in Olathe. These are services that he pays for out of pocket. Why? Because he is on that Hcbs wait list going on now 7 years. And there's still about 900 people ahead of him, as I understand it. He has little prospect of getting off that wait list before he runs out of money. But that's not the end of it. You know, we're thankful that Lake Mary could provide Nick beginning in 2015 with support services. But today, Lake Mary's at capacity. Staffing levels, you've heard, are at an all-time low, and with only 45 full-time support staff serving adults rather than the customary 90 staff positions. Direct support staff, they're struggling every day. I hear it from my son to provide him the services that he needs. I see teams working overtime and double shifts, leading to burnout, employee turnover. Workers are finding better paying jobs, and they don't have the stress that are required to serve the complex needs of the disabled. Now, we all know for a long period of time, the last 2 decades, what the cumulative effect of funding shortages is doing. It is putting at risk the health and the well-being of my son and 9,000 other Kansans statewide with IDD. And not to mention the more than 4,000 that are out there in the wings waiting for services. And guess what? There isn't any place for them to go because providers are at capacity. I think as a parent and as a taxpayer, as a Kansan, we stand at a critical junction right now. We either spend the money to provide the proper funding or we face unimaginable consequences. You know, these are the things that keep me awake at night. I'm 76 years old, and I agonize wondering if a viable support system will be in place after I'm gone. See, for the past 50 years, Lake Mary has made it possible for people like my son to live and work with respect and dignity in their communities and become productive citizens, as my son is. But perhaps this is what attracted Senator Bob Dole's attention. He was a keynote speaker, if you didn't know this, at Lake Mary's dedication ceremonies back in 1970. He even procured the funding to build the Paola campus that features the Dole Family Center. And Senator Dole later said this, and I didn't realize this until recently, that he championed the American with Disabilities Act because of his personal experiences with disabilities, but also how Lake Mary's support of the disabled inspired him. Now, we hope you share Senator Dole's passion and commitment to doing the right thing for the intellectually and developmentally disabled. We ask that you cast your vote in support of the critical need for a substantial increase in funding. Thank you, and I stand for any questions that you have.
Very good, Ron. Thank you for being here. Committee questions. Seeing none, thank you very much. Next, I have Jim Huber. Oh, there you are. Okay. Please limit your testimony to about 3 minutes.
Chairman and committee, thank you. I will. I'm Jim Huber. I'm the parent of an adult at Lake Mary also. You might get the feeling that the Lake Mary parents are organizing. Well, I am, because on Christmas Day, When I picked up my son, I got greeted with smiling staff. They were happy. When I took him back in the evening, I got greeted with smiling, same faces. And I thought, wasn't there a shift change? And then I found out, because I asked some questions from people who didn't want to say that they were doing anything but taking care of everything. One of them had been there all Christmas Eve day, all Christmas Eve night, and all Christmas Day, so that some of the other staff members could have Christmas with their families. That's the kind of sacrifices I was seeing. And then I looked at the others, and I saw deep sunken eyes, and I saw tired people. And I found out, as you heard the number, that they only have half the staff they need. My son's house has 32 shifts in a week. Those shifts require 4 people plus a floater. They have a staff of 1 manager and 6 to cover those 32 shifts. That's when I decided that I could come up here and speak to you and say, this is a serious crisis. And you heard it a little bit. My son came out of Kansas Neurological Institute. He was one of the first people come out of an institution, and we were told how lucky we were to go to Lake Mary. Well, if something doesn't, I have no shame. That $58 million is absolutely necessary, and I think it's my state's moral obligation to stand behind it. And if we don't do that, then I see 3 options. My son and his peers are either going to be sitting on the curb, they're going to be in jail, or we're going to reopen those state institutions up. Let me say warehouses, and they were good people, but that's what they were. My son never wanted to go back when I took him out. When I take him out now, he wants to go back to Lake Mary. It's a great place. He has a good life. Thank you very much.
Any questions? Representative Ballard.
Yes. Give me one thing that you especially appreciate about Lake Mary.
I can't give just one. It is top to bottom. I have a CEO who knows how to clean messes in bathrooms, and if there's a problem, he's there and he can do it himself. I have a staff who, and you know, we talk about levels of pay and these people. These aren't just plain people. They have passed thorough background checks. They have cleared drug tests. They would be excellent employees any place. These are desirable people, and we're down to a small nucleus who are there taking this kind of abuse out of their love and affection. I tell people, if the house my son is in were on fire, I would run in, as would any parent, but so would his staff. That's what I appreciate about Lake Mary. Top to bottom, they are there. They are just an incredible group of people, and I'm watching them be destroyed, and I can't stand it. I'm sorry.
That is a wonderful testimony for that. You know, and the other reason I asked what the question was, Nancy Luss was a representative here, and she served on this committee with us for so many years. And she was here last week, not in this committee, but in the Capitol. And she is on the board for Lake Mary. And she was telling me how enthused she was. So I thought, well, let me talk to a parent that's been there. And tell her what you had to say.
I have been there, and I can't see the place like this allowed to just sink. You know, that's a lot of money. They're right. We have eroded over the last 10 years. So that big amount of money isn't like a sudden hill. It's coming out of a hole. I think did I see someone else?
Representative Helmer.
I just wanted to make a comment. I grew up, my step-grandma worked at Winfield State Hospital, and I sure don't want anybody to go back to those hospitals. I thought that was the norm. It's not the norm. So thank you very much for testifying.
I don't want to, on the other hand, disrespect them. There were people there who were good people. They tried as hard as they can, but you can't keep people in a warehouse and do a very good job. And as one staff member there told me, we're doing the best we can, but you wouldn't want to live here. And you know what? I'd live at Lake Mary in a heartbeat. Thank you.
Very good. Committee, further questions? Thank you very much, Ron, for being here. Or Jim, sorry. There you go. Okay, next I have Rachel Marsh, and she is here in person. Rachel, welcome to committee.
Mr. Chairman and members of the committee, I will be extra brief. I think I have used my number of minutes in front of Representative Helmer this week. I'm here to speak on behalf of the PRTFs of Kansas. I want to just share some facts. The work that you have done, this committee, over the past few years, I've worked with you personally to address the crisis of the PRTFs that we were facing. And the work that you did created the physical infrastructure that we need today. And I would like to tell you that that's all that we need to do, but we do have the workforce issues that you're hearing, and you've got my written testimony. What I want to let you know is just to keep the PRTF as part of your consideration of all the requests that you're hearing today for the workforce across the state. I did not realize until I spoke with one of my members, they said the suicidality that we're seeing at our PRTFs is the highest they've ever seen. And so I'm finding it difficult to listen to all this testimony today, and I'm just so grateful for the time and energy that you all put in to trying to figure out how we can best meet the needs of all of Kansas, really, that are struggling. So I appreciate your time and energy and ask you to consider our request for PRTFs. Thank you.
Very good. Committee questions? Thank you, Rachel. You know, I think you see on your testimony, you can see that we've worked very hard. We just can't staff a building or we wouldn't have a wait list. And that just seems so unfortunate for us. So, okay, stay tuned. Thank you. Next, I have Crystal Hedrick, Foster Adopt Connect. Crystal, are you there? Crystal, can you hear us? Are you muted?
Hello, can you hear me?
Yes, we can hear you now.
Very good. Sorry, some tech issues on this end. Thank you, Mr. Chair, for having me here with you today. My apologies for not being with you in person. My name is Crystal Hedrick. I'm the Vice President of Kansas Programs with Foster Adopt Connect. We are a small nonprofit social service agency focused really exclusively on filling gaps in the child welfare system and securing positive outcomes for kids who have been abused and neglected. We were founded in 2000 by our CEO, Lori Ross, and her husband, Randy. The two of them have fostered over 400 kids and adopted 23 children over the years. I myself am also a former foster parent and adoptive parent to 4. Many of our staff share similar personal and professional experiences as it relates to the work that we do serving kids and families that are impacted by the foster care system. We currently caregivers to children and high-risk programs at Foster Adopt Connect, but the one that I really want to share with you about today is our behavioral interventionist program. We provide one-on-one services to high acuity youth who struggle to regulate their emotions and behaviors and cause unsafe situations for them and their caregivers. So our behavioral interventionists work in the home, relieving caregivers during busy times in their home so that they have the support to really care for other kids in the home too. But we also do some neurodevelopmental activities to assist in rewiring the brain and helping those kids heal from their trauma. So to summarize my written testimony that you have, for every child that we're able to divert from a PRTF through the utilization of this program would be a cost savings of just over $50,000. In 2019, prior to the pandemic, 80% of the kids that participated in our BI program avoided PRTF or residential care. In 2020, the first year of the pandemic, that dropped about 5% to 75%. but we were still serving about 150 kids. So we currently have a small grant from DCF focused on retention of foster families and placement stability, serving those kids that typically would be in a PRTF. And then another small investment of VOCA dollars, which supports a handful of kids in Kansas. We're actively pursuing Medicaid coverage to fund this BI program long term, but may need some legislative support to be successful with that moving forward. We're also hopeful to leverage an investment of Spark funds to help expand these services over the next few years and continue to demonstrate successful outcomes with this program and cost savings as well. So an investment of $500,000 annually to Foster Adopt Connect to offer these BI services and reduce the need for hospitalizations and residential care would serve over 40 Kansas kids each year. So thank you for the opportunity to present. I did it a little quickly, but I'm happy to stand for questions.
Committee questions? Very good. Seeing none, Crystal, thank you for being here.
Thank you.
I have Rachel Munger, Leading Age Kansas. Rachel, good morning. And thank you for being here.
Thank you, Mr. Chairman. This is on, right? Okay, good. I'm Rachel Munger with Leading Age Kansas for the State Association for Nonprofit and Faith-Based Aging Services, and appreciate the opportunity to comment on the governor's budget. And I want to start by thanking this committee for last year, the funding that you gave us, because so many of our members would not be here today if we did not get that extra funding. And so we remain very grateful. This year, the governor's recommending a 3% increase for nursing homes. However, we know that is far from the amount needed to fully fund nursing home costs and the reimbursement owed to them under Kansas law. According to the numbers provided to us by KDADS, actual full funding of nursing home Medicaid rates would require around 34 million SGF, and that's based on the average cost for nursing facilities in 2019, 2020, and 2021 with an inflation factor, and that's all in my written. Over the last decade, and especially the last 2 years of the pandemic, long-term care has faced an ever-deepening workforce crisis, and they are in desperate need of help still. Nationally, long-term care has lost 15% of its workforce in nursing homes, 7% in assisted living, so 22% combined. And we absolutely feel that here in Kansas. And I know you all have heard over and over about the staffing crisis and the spiraling cost of staffing agencies. We introduced House Bill 2524 to try and cap the charges of staffing agencies and hold them accountable for predatory business practices, knowing it would be a difficult fight, but also knowing that we have to get a handle on these costs somewhere. And we are very grateful that House Children and Seniors voted today in favor of an amended version of that bill, and we're very hopeful we can keep pushing that forward, because honestly, as we stand here today, we really don't know what we're going to do in order to keep paying these costs and sustaining business and caring for residents. We do believe that the least we can ask today is that the state fully fund our Medicaid reimbursement. Those rates are set out in Kansas statute. They're supported by the last 3 years of cost reports. It is what we are statutorily owed for taking care of the most vulnerable in our state during the worst public health crisis in a century, and it is desperately needed. Anyone who's looking knows how very precarious long-term care is at this point and what that means for the residents in our care. So we ask that you please help by recommending full funding of nursing home Medicaid rates in state fiscal year 2023. Thank you, Mr. Chair.
Very good. Committee questions, Rachel. Thank you very much for being here.
Thank you.
Next, I have Mark Hind, Southwest Developmental Services. Mark, thank you for being here.
Chairman Carpenter, thank you for having me, and members of the committee, thank you as well. I'm President and CEO of Southwest Developmental Services Incorporated. We're a community developmental disability organization, or CDDL, for 18 counties in Southwest and Central Kansas. Yes, sir.
I scratched someone. Haley, we'll get to you in just a minute, okay?
Okay, thank you.
Oh, very good.
Okay. Again, we're the CDDL for 18 counties in Southwest and Central Kansas, with an office in Garden City and an office in Great Bend as well. SDSI is a CDDL. We do not provide direct service supports to individuals. We have community support providers, 29 affiliates that provide those services to the individuals. We have currently 1,025 individuals that we serve eligible. We have 321 that are on that wait list. I will keep this very brief because there's a couple other things I want to visit about before I get done. But as one of 27 CDDOs across the state of Kansas, we have taken on more responsibilities through the years here with CanCare, with KDADs, and have not got reimbursed, have not had any kind of CDDO administration increase at all. It has been well more than a decade. I was looking at our contracts, went back 12 to 15 years and did not find any kind of substantial increase in that. Through the years, SDSI has taken state aid and county mill, put them into what we call a local finance plan. We have taken money from that to supplement our budget, and then the rest of that we pay out to providers in that local finance plan for service categories such as transportation, such as Medicaid ineligible individuals, and there are other categories that we've had to get rid of because we didn't have the funds to do that. The dollars that we have supplemented our budget with range from $100,000 in 2010 to, in 2022, $285,000. And then the rest of that, again, goes out to our providers. This year, we're looking at about $580,000 that we pay out to our community service providers, our affiliates, for those different categories. The overall cost of business, as you have heard from everybody or from a number of people here today, in attracting, retaining employees, paying for vehicles, fuel, other expenses, has gone up dramatically. It's going to continue to go up. What we're asking for is a $2.5 million increase for CDDO admin. That's all funds. We think it'd be a reasonable step to help sustain a key state partner in the delivery of the Kansas IDD system. As Dean Eiswanger talked about, as a CDDO, it is our responsibility to ensure that we have service providers, to ensure that we have the service providers that can take care of the individuals we have in service, and then also look into the future when we're able to take folks off that wait list, that we have them. We have several service providers right now that are capped. We have a couple that have just retired or in the process of retiring. With that, we have some great concerns of how we're going to proceed with this. One other quick thing, I would say that I didn't put it into my testimony, but we support a rate increase for the service providers as well. What Matt Fletcher referred to, what Dean Eiswanger referred to, what a number of others, Ron Fugate talked about, a number of other folks, we think is critical. We are at that, I think at that junction point that things could go south in a hurry. So with that, I'll stop and stand for any question you have.
Questions? Thank you very much.
Thank you for consideration.
All right, now Haley, are you there?
I am. Thank you.
Very good. Thank you.
I understand.
Welcome to committee.
Thank you. I understand your time is of an essence, so I will try to be very brief. Our ask is the same as leading age, where rather than 3% increase, we just have KDADs actually follow the statute of their own language, which would be to do the 3 years average. The 3 years average and, sorry, I think I cut out there. The 3 years average and a rebase up to adjust for inflation. For anyone that doesn't know, I want to briefly try to educate on how our rates are determined. Annually, we submit our audited financials that is known as a cost report, which is essentially the cost of us delivering care. We submit these to Myers and Stoffers, and it's audited and then forwarded to KDADs from there, where they then calculate what the average of the last 3 years of our cost of services are, establish spending caps. That is done by legislation of what is the highest allowable rate for certain cost areas, such as wages. And then whether we receive the rebase or not. And the appropriations for that to support the rebase is debated each year. Historically, it has been allowed about 50% of the time. You can see the statute for that language in my testimony. And I want to give a couple real case examples of why we feel so strongly about the need to follow the statute. One of our several nursing homes have closed in the state. You can see that in my testimony. And among them, the second one at the top is my own facility. We sold the operations and closed the facility about a year ago. At that time, my cost for providing daily services was $262.30. My Medicaid reimbursement rate was $174.67, so a difference of $87.63 with 73% of my building Medicaid population. Bethany Home in Lindsborg, another one of our members, their cost of daily care is $321. Their reimbursement rate is $229. They're essentially losing a little over $91 each day for every person who relies on Medicaid, and they have a 62% population of Medicaid in their building. Evergreen Community in Olathe, their cost of care is $335.10. Their reimbursement rate is $248.30. They too are losing a little over $36 each day for each person who relies on Medicaid, and 67% of their building population is Medicaid eligible. This is a huge problem, not only for the Kansas resident population, the seniors, the communities where we provide employment for many individuals. I was previously here last month testifying as a proponent that Rachel mentioned to House Bill 2524, which we're very thankful has passed with the amendments. But we were asked, why don't we just increase what we pay to the staff and solve our own problem that way? Well, as you can understand, based on these calculations, based on legislation, we are capped by our own reimbursement rate. We can't just, we don't have the luxury of free market to be able to increase our cost. So just in conclusion, funding the program adequately might sound like a bigger cost in the front end, but in the long run, it'll provide more choices for our Kansas elders to remain in the communities of their choosing, for more employment opportunities throughout the state, and most importantly, to provide excellent quality of care for elders who call these adult care home their homes. And I would actually reference you to look further down on my testimony at the facilities that have closed over the last year: Clearwater, Kansas City, Lawrence, Southeast Kansas, Wichita, Olathe, Overland Park, Valley Falls, Overbrook. And that's just Q1 through Q3 of last year. We don't have the data for Q4 last year, but we're hearing on average it's anywhere from 4 to 5 buildings each quarter in the state of Kansas. So thank you for your time, and I'm happy to stand for questions.
Very good. Committee questions. I have just one quick one. How many of those reopened?
We haven't gotten that information from the state. We just get the information of who has either closed by forfeiting their licensure or who has been a reduction in capacity. And I believe of that list, 10 of those just in the 3 quarters, I believe 3 of them were simply a reduction in capacity to remain available to reopen again in the future.
So it's not accurate. They haven't given up their license yet.
Only 3 of them have not.
Right. Okay, very good. Because I know 2 on here I don't see on this list that I know are closed, but they may not have given up their license. So, yes. Well, very good, Haley. Thank you for your testimony, and we appreciate it. Okay.
Can we ask you a little question?
Yeah, you got it. Oh, your time's up.
It took me by surprise. I had to cough. All right. So if they've given up, they haven't given their license up yet. They're not closed, but they may not have any individuals within it. Okay. So I guess my question would be, we can ask later, how long can they do that? Like,
I don't know. That's a good question.
Are they waiting to get people, or do they have people coming in, or that way they still can hold on to it?
I'm just guessing, but I would imagine it's fairly difficult to apply for the license, so they'll keep it open if they can. But I know of one, I was on a Zoom call yesterday with one, and they just had 5 people in a wing, in a home. So, yeah. Okay, Haley, thank you very much. Next, I have Linda Mobre, Kansas Healthcare Association.
Good afternoon, early evening, Mr. Chair. I hope you can hear me.
We can. Thank you.
Excellent. I'm Linda Mobre with Kansas Healthcare Association, Kansas Center for Assisted Living. Thanks to Francie, all of you should have my view. So again, I won't take time to read it to you. We have really 3 asks. The first is we want you to strongly consider fully funding KDADs with their increased staffing, with their increased positions, with how they're trying to remanage. They have a huge job and a huge responsibility. And the state, like everybody else, is having difficulties finding and retaining good quality staff. So please do support their budget so that they can have a little more leverage to find those folks that work our programs. Next, I'd like to reiterate what Haley Ordwine with CASE has said and Rachel Monger with Leading Age Kansas, and that is our nursing homes need to be fully funded. It is a huge number, $34.8 million, but do understand that is based on money that was already spent in 2019, in 2020, and 2021. There is an inflation factor with it, but that money is already out the door, and I can only imagine that the costs are going to continue to go up. So we really need to get a square footing with our nursing home rates to keep them a viable option for Kansas seniors. The last ask is on the assisted living side. Assisted living can serve individuals on CanCare through Medicaid waiver programs. Most would be the frail elder, some with the physical disabled, but those waiver programs really are very underfunded as far as what the cost of care for an individual is. My testimony shows you that a unit of care is 15 minutes. The facility is reimbursed $4.49 for that unit of care. That's $17.96 for 1 hour of nursing care, regardless of whether it's a CNA, an LPN, or an RN that's providing it. And our homes are paying upwards of $40 per hour for nurse aides from the staffing agency. That's so out of balance. You know, we really appreciate that you have taken Kansas seniors' needs seriously. You've helped us last year. You've helped us so much throughout the pandemic. I wish I didn't have to come out with my hand out one more time for our providers. But quality costs money, and our Kansas elders are worth it. Thank you so much.
Very good, Linda. Thank you for being here. Committee questions? Seeing none. Last, Lisa? I thought that was you. You were sitting there very quietly throughout the whole time. Lisa Southern, Compass Behavioral Health. Thank you for being here.
I too will abbreviate because you do have my written testimony. I am Lisa Southern, and I'm the Executive Director for Compass Behavioral Health. We serve 13 counties in Southwest Kansas. We employ about 200 people. We provide access to care 24/7, 365. That's my best way of summarizing that we never stop. We are responsible for the delivery of publicly funded community mental health services, and we are the safety net. So a couple of points to hit on is support of the 4% behavioral health Medicaid rate reimbursement increase. To do the work we do to keep people safe and well taken care of, to give them the health that we are all fortunate enough to have, we have to meet their needs. We work to give our all to people in the community, and often the funding to support that does not come with that. When we operate at our current capacity and beyond with the same number of staff and at times less, we risk losing our staff from exhaustion, and that of course will impact service delivery. I did participate in the Legislative Mental Health and Reform Committee, and a recommendation was made from there to have a 10 to 15% increase to reimbursement rates, but we are asking to support the 4% increase. CCBHC mini grants. So much thanks to the Kansas Legislature for passing the CCBHC model in Kansas. This is substantial and is going to transform the way we do things here in Kansas, probably just like the transformation that came with the closure of the state hospitals. I would like to give an additional thanks to KDADS for the implementation of the $400,000 mini grants. Compass was fortunate to be one of the few centers who received that money. We have already started some work with this. We've hired 2 care coordinators and are scheduling some intensive trauma-focused training for our staff. This is only the beginning, and this seed money will be of great benefit. It would cost $4.8 million to give this same funding to the remaining community mental health centers, and again, that is strongly recommended and supported. Crisis Intervention Center funding. I'm sure you guys hear all the time about the limited number of beds of private psychiatric units as well as the state hospital. A way to help with that is to have more crisis centers in Kansas. Compass does have a children's crisis house, and we're very proud of the work that we do there. In 2021, we had 1,743 crisis services provided to 883 adults, 860 to children. And this was an 11% increase over the previous year. As has already been stated, the pandemic has been very difficult for people. We were able to only hospitalize 8% of that number at Larned State Hospital. 74% were diverted to community resources that we have put in place in our 13 counties. We must continue to follow the outcomes of this level of care and look at increasing the funding, as we all feel confident the research is going to show that these crisis centers are very effective in treating people in their community. Finally, the 988 National Suicide Prevention Lifeline. This number will be nationwide and allow people to get help by dialing 3 numbers 24/7, 365. There's a whole world of people who need our help. Those that come in for help know how to access that help. Those who don't just need to dial this 3 numbers and they will get help immediately. Thank you for the opportunity to present today, and I will answer any questions you might have.
Very good. Committee questions? Seeing none, thank you very much for being here. Committee, that concludes our testimony. If I've forgotten anybody? Okay. Yeah. Thank you. Committee, I might bring your attention to the second page here written. It's on your computers. So your homework assignment this weekend is to read through the testimony. Monday, we will do recommendations for Kansas Department of Aging and Disability. Okay? And kind of the same process that we did on the See Me. If you've got some, or email them to Matt, or we'll kind of sort through them and see what's going on. So, okay, very good. Thank you. We're adjourned.